Welcome to the CPHA's 2022 Annual General Meeting. I'm Vamini Selvanandan, Chair of the CPHA's Board of Directors. And for those who do not know me already, I'm a family physician working in primary care and emergency medicine. I also work on the evaluation of health promotion programs to provide real-world evidence to improve public health practice and public policy. I would like to acknowledge that CPHA's office is located on the ancestral unceded territory of the Algonquin Anishinaabe people. CPHA is committed to working with all First Nations, Inuit, and Métis peoples and their governments in realizing meaningful truth and reconciliation. To that end, I'm pleased to report that our Indigenous Advisory Council has been established, has met several times over the past year and a half, and has begun providing guidance to the Board of Directors. I'll have more to say about that in a few minutes. I'm participating in today's call from my home in Banff, Alberta, the traditional territories of the people of the Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, Piikani, and Kainai First Nations, as well as the Tsuut'ina First Nation, and the Stoney Nakoda, including the Chiniki, Bearspaw, and First Leaf First Nations. Banff is also home to Métis Nation of Alberta Region 3. Please feel free to use the chat box to indicate the traditional land from where you're joining the meeting today. La langue de travail de l'association est l'anglais. Et aujourd'hui, nous n'avons pas d'interprétation simultanée à l'Assemblée, mais nous invitons les membres de s'exprimer en français ou en anglais, comme vous voulez. I will now turn it over to Ian Colbert, CPHA's Executive Director, to cover a few housekeeping notes before we get started. Ian?
Thank you, Vamini. So, as you're all aware, we are using the Zoom video conference platform with which I'm assuming you're pretty much familiar by now. So you'll note that you are all muted to avoid any unnecessary background noise, but you can be unmuted if you wish to speak. You should see a toolbar at the bottom of your screen. It contains a couple of tools that will be helpful during today's call. When we get to the substance of today's meeting, please use the Q&A feature to ask a question, or click on raise your hand and your line will be unmuted so you can ask your question aloud. When the time comes, if you would like to move or second a motion, click on raise hand and you will be able to vote on motions by way of an on-screen poll. Finally, today's meeting is being recorded for note-taking purposes, as well as being live streamed on YouTube for non-members to observe. That's it for our housekeeping items, and I can confirm that we have quorum for today's meeting. So back to you, Vamini.
Thank you, Ian. I'm encouraged by how many of you have taken the time to join us today, given the ongoing challenges posed by COVID-19. Your interest and dedication to CPHA is greatly appreciated. I'll start by introducing my fellow board members. Jason Sabai is our chair-elect and chair of the Nominating Committee. Nasreen Dalla, Monica Emode, the chair of the Finance Committee, Yiping Ji, Caitlin Johnston, Sume Ndumbe Ayo, chair of the Awards Committee, Thomas Piggott, Kamisha Ramatian, our new student director, and Laura Taylor. The board of directors is supported by 6 standing committees that do the pre-work of the board of directors. They analyze issues and present options and recommendations to the board. The finance committee supports the association's operational planning and budgeting processes while developing and monitoring a long-term financial plan. The honorary awards committee supports the board in recognizing individuals who and organizations that have made significant contributions to public health. The Indigenous Advisory Council supports CPHA in fulfilling its role as a trusted advocate for public health, working towards addressing the historic and contemporary health inequities faced by Indigenous communities. The council brings Indigenous perspectives to the association's policies, practices, and programs. The Nominating Committee supports board sustainability through succession planning and the implementation of a nominating process by which board members are elected to the membership, by the membership. The Public Policy Committee assists in identifying issues, suggesting priorities, and developing options and providing recommendations to the board regarding our policy position statements. The board is extremely grateful for the volunteer members of our standing committees and the hours of work they provide to support CPHA in 2021. As you'll see from the agenda, the AGM is your opportunity as members to hear about the business of the association. It is also the board's opportunity to hear from you. Formal motions from the floor are required for only 3 of our standing agenda items. Any member can be a mover or seconder and can vote. When the time comes, please click the raise your hand icon if you want to move or second a motion. The rules of order for today's meeting are included on the second page of your information package. I'm pleased that Lynn McIntyre has agreed to be our official parliamentarian for today's meeting. I will rely on her guidance should the need arise. Having said that, I hope that this meeting will be more like a conversation. We want to hear your thoughts about the progress we're making and the future direction of the association. The board is present to hear your perspectives so that they can be included in our forward planning. If you have ideas for policy options for which CPHA should be advocating, members can always submit a proposed position or policy statement at any time. Visit the policy and advocacy section of our website, where you'll find information on the policy development process and guidelines for submission. Now we'll move to agenda item number 2, the adoption of the minutes of our last AGM. You have a copy of the minutes in your package starting on page 3. Can someone please move that the minutes of the May 5th, 2021 Annual General Meeting be accepted as circulated?
Moved by Hope Beanlands, seconded by Faye Stark.
Thank you. Is there any discussion or corrections to the minutes? Okay, hearing none, may I call the question? I'll ask the staff to launch the vote, please. You should see the motion question on the screen in front of you now. So please vote and then click the submit button. We'll give it a minute so that everyone has time to vote. And once the staff sees no voting activity for a few seconds, we'll close the poll. Thank you, everyone. The motion was approved. I now ask Monica Imo, Chair of the Finance Committee, to present the 2021 audited financial statements. Monica.
Thank you, Emily. Hello, everyone. I'm pleased to present the 2021 audited financial statements for your review and consideration. These statements begin on page 11 of your package. Both the Finance Committee and the Board of Directors have reviewed these statements and have recommended them for your approval today. Our goal is to have a balanced budget over any 3-year period, understanding that there may be fluctuations on a year-to-year basis. Fortunately, the 3-year budget cycle ending in 2021 was in a surplus position, and I am pleased to inform you that based on current projections, we will remain in a surplus position for at least the next 3 years. Starting on page 12 of your package, you have the letter from the auditors to the Board of Directors that details the terms of reference and specific conditions of their audit. I'm pleased to note that CPHA has once again received a clean audit, as indicated by the opinion at the start of the letter on page 12. Turning to page 14 of your package, The statement of financial position shows an increase of almost $437,000 in assets. Liabilities also increased, but by only $310,000, leaving net assets at just over $1 million. Turning to page 15 of your package. The statement of changes in net assets reflects the remaining assets. Again, this is just over $1 million. And turning to page 16 of your package. The statement of operations on page 16 reflects the revenue increase of almost $300,000 and net revenue or surplus of $126,000 for the year. This represents a significant positive variance from the original budget for 2021, which included a forecast deficit of almost $169,000. Turning to page 17 of your package. The statement of cash flows shows the movement of cash throughout the year. It reflects the increase in net revenue, resulting in an increase in the amount of cash available. There were no new accounting policies in 2021, and the remainder of notes provide a breakdown of what is on the financial statements. There was nothing in the notes to which the auditor needed to draw attention. So the board of directors, along with our qualified and dedicated finance committee, continue to monitor the association's fiscal well-being very closely and remain optimistic for the future. I'll turn it back to Vamini to entertain a motion.
Thank you, Monica. We need a motion from the floor before opening the discussion. Can someone please move that the 2021 audited financial statements of the Canadian Public Health Association be accepted?
Moved by Thomas Pigott and seconded by Sharon Yanicki.
Thank you. Is there any discussion or questions? No? Okay. Thank you. Hearing none, I will call the question. I'll ask the staff to launch the vote, please. Should see the motion question on the screen in front of you now. So please vote and then click the submit button. We'll give it a minute so that everyone has time to vote. And then once the staff sees no voting activity for a few seconds, we'll close the poll. Okay, thank you, everyone. The motion was approved. I'll ask Monica to present our next agenda item as well.
Thank you, Vamini. I will now address the appointment of the CPHA Auditor for 2022. CPHA continues to receive excellent service and very competitive pricing from the firm of Wellesley, Hanneby, Clipsham, Deep. As such, CPHA's Finance Committee and Board of Directors recommend that the firm OHCD LLP be appointed as CPHA's Auditor for 2022.
Thank you, Monica. Can we please have someone move that the firm of OHCD LLP be appointed as CPHA's auditors for 2022?
Moved by Laura Taylor and seconded by Marie Deloyer.
Great, thank you. Are there any questions or any discussion? Okay, hearing none, I'll call the question. I'll ask the staff to please launch the vote. You should see the motion question on the screen in front of you now, so please vote and click the submit button as with the motions before. We'll give it a minute so you have time to vote. And then the staff will close the poll when they don't see any activity for a few seconds. Thank you, everyone. The motion was approved. Now we'll move on to agenda item number 5, which is a CPHA annual report. It is now my pleasure to invite Jason Sabai, CPHA's chair-elect, to present the Nominating Committee report.
Thanks, Vamini. So as chair, I'm pleased to present the report of the Nominating Committee, which implements the process by which the board members are elected by the membership and offers advice to the board on ongoing processes and possible appointments. In keeping with CPHA's bylaws, Vamini stepped into the role of chair of the board of directors with the passing of our former chair, Benita Cohen. Vamini will complete Benita's second year as chair, as well as serving her own 2-year term. In March of this year, the board also nominated me to become the new chair-elect, and that nomination will be put to CPHA's membership for ratification as part of this year's election process. Effective January 1st, 2022, 2 new directors began their first 2-year term on our board of directors. Nash Dalla from Vancouver and Kamisha Ramashian, our new student director, also from Vancouver. Monica Mode, our former student director, was re-elected for a second 2-year term. And Caitlin Johnson was appointed for a 1-year term to fill the vacancy on the board. For more information on all of our board of directors, please visit CPHA's website. I would also like to take this opportunity to recognize the dedication and contributions of Katie Sue Derechko and Donica Jones, whose terms ended on December 31st of last year. The formal call for nominations for the 2022 election will be circulated to all members in June, with a closing date of August 31st. Elections will take place in October and November. And while we are seeking candidates who collectively possess a mix of knowledge, experience, and expertise, we are particularly seeking directors from a variety of public health disciplines and roles who can bring experience in the distinct needs of diverse populations and communities, with finance and business, or communications and membership engagement. As always, we are interested in increasing geographic diversity of the board, especially from the North, Quebec, and Atlantic Canada. I encourage you to consider this call. If you feel it's a fit for yourself or a colleague, feel free to contact a member of the nominating committee or the board by sending an email to nominations@cpha.ca. We welcome the opportunity to talk with you personally about standing for election or nominating a colleague. And now I'll turn it back to Vamini.
Thank you, Jason. At this time, I'm pleased to present CPHA's 2021 annual report. Throughout my report, I'll refer to various papers and other documents, all of which are available from the CPHA's website if you're interested in finding out more. Many of you remain intensely engaged in the daily demands of responding to COVID-19 in our communities. While COVID-19 continued to dominate all aspects of our lives in 2021, it also brought public health and the people who work in it into sharp focus for Canadians. And while the public's support for public health measures may have waned during the year, your efforts have made the crucial difference in helping to protect the health and well-being of everyone in this country. Throughout it all, CPHA continues to be the voice of public health, and we will continue to speak out on the public policy issues that matter to you. That has been our role since 1910 and will continue to be for as long as the association exists. We hope that is a legacy you will continue to support. A significant achievement in 2021 was the launch of the association's strategic plan for 2021 to 2025. This plan, called the Roadmap to Change, charts a new course for the association that builds on the strengths established by previous strategic plans. The plan features new vision and mission statements for the association, as well as inextricably linked organizational values that are a declaration by CPHA of what it holds important and to what it aspires. By communicating and living these organizational values, CPHA knows where to put its attention, can make decisions more quickly, and can commit fully to those decisions. The board of directors is focused on advancing work on our 6 interconnected strategic priorities, and I'm pleased to be able to report to you today on some of our progress. As part of our ongoing commitment to truth and reconciliation with First Nations, Inuit, and Métis peoples, CPHA established an Indigenous Advisory Council that meets quarterly to discuss a wide range of topics and to provide feedback on CPHA's policy development. The Council has supported plans to hold a quarterly online gathering for Indigenous public health workers and to establish a practicum placement for an Indigenous MPH student that will be paid a living wage by CPHA. In collaboration with the Council, CPHA will also be releasing a statement on National Truth and Reconciliation Day this September. Throughout the pandemic, CPHA continues its efforts to respond to public health issues by developing evidence-informed approaches and policy alternatives. As previously reported, we conducted a review of Canada's initial response to the COVID-19 pandemic that provides a non-governmental perspective, an overview of the public health measures taken during the first wave of the pandemic, and those actions taken to address social determinants of health. This report identifies the need to strengthen supply chains for PPE and to improve collection of race-based and socio-demographic data, while recommending a basic income for Canada and identifying the need for a federal public health act. CPHA was part of a group of 30 health organizations and 644 health professionals calling on the Government of Canada to dedicate more resources to supporting the equitable global supply of vaccines. Population mental health has been an underlying theme in much of the association's recent work, whether it be to address children's access to play, substance abuse, the social determinants of health, stigma and racism, Jordan's principle, or sexual health. Our new position statement on a public health approach to population mental wellness describes how personal, social, and ecological determinants of health can affect population mental wellness and how public health approaches can be applied. In May 2021, CPHA released a position statement entitled Tobacco and Vaping Use in Canada Moving Forward. Tobacco products and nicotine-containing vaping devices are used to provide nicotine, an addictive substance. However, the two products have differing health effects. The position statement included a series of recommendations directed at federal, provincial, territorial, and municipal governments. On 25th of March 2021, the Supreme Court of Canada ruled in favor of the constitutionality of the Federal Greenhouse Gas Pollution Pricing Act 2018, affirming the authority of the federal government to set national standards for carbon pricing. CPHA was an intervener that supported the federal government and applauded the decision, noting that greenhouse gas emissions are a quintessential public health concern because the emissions, wherever the source, disrupt biophysical and economic systems, threatening the well-being and health of populations everywhere. In collaboration with the Canadian Health Association for Sustainability and Equity and the Ontario Public Health Association, CPHA produced a series of blogs, fact sheets, and backgrounders to disseminate important and timely research on the need to improve public health, decrease health inequities, and provide beneficial side effects in the fight to address climate change. The Lancet Countdown on Health and Climate Change is a comprehensive yearly analysis that tracks progress on key indicators of the impact of climate change on human health and the world's efforts to minimize it. The policy brief for Canada provides country-specific recommendations by leading domestic experts to highlight areas in which leaders and policymakers should focus to develop a healthy response to climate change. With funding from the Public Health Agency of Canada, CPHA's Infectious Disease and Climate Change Project organized a national poster contest for grade 6 students from across Canada to learn more about climate-sensitive infectious diseases like Lyme disease and West Nile virus, and share awareness and prevention information with their communities. The 2021 national winning entry was created by Victoria T., a student at Edmonds Elementary School in North Vancouver. The Infectious Disease and Climate Change Project also published a key informant report that describes what's happening in Canada with respect to climate change and infectious diseases and highlights challenges and opportunities within this emerging field of inquiry. With funding from the Public Health Agency of Canada, CPHA launched a free online continuing professional development course entitled Providing Safer, More Inclusive Care for People with STBBIs. Intended for family physicians and other clinical care providers, this modular course explores the stigma and discrimination often encountered by patients or clients seeking services for sexual health, substance use, or STBBIs. The Canadian Substance Use Resource and Knowledge Exchange Centre launched a new website created by CPHA to support the implementation of a public health approach to substance use. Visitors can access hundreds of free knowledge exchange products, bookmark resources, and save searches on the website. Turning to conferences, CPHA hosted 3 very successful virtual conferences in 2021. And while the annual conference will be a virtual event again this year from June 14th to 16th, we're planning to hold the 2022 Canadian Immunization Conference in person in Ottawa this December. I want to end my report by commenting on CPHA's dynamic and engaged membership, which includes all of you participating in today's meeting. Members demonstrated their commitment in so many ways in 2021. These contributions are invaluable and allow the association to do so much of its work. So a big thank you to all of you. While we had many accomplishments in 2021, CPHA and the entire public health community also suffered a great loss with the sudden passing of Benita Cohen. In addition to being the chair of CPHA's board of directors, Benita was an associate professor in nursing at the University of Manitoba, where she focused on mentoring students to become health equity champions. Her research projects included exploring public health nurses' role in addressing child and family poverty, an equity scan of Canadian tobacco control policy, a health equity impact assessment of a provincial parenting program, development of a conceptual framework of organizational capacity for public health equity action, and a systematic review of public health's role in advocacy for health equity. Benita received the 2013 Community Health Nurses of Canada Award for merit for her contributions to the field of public health and community health. As the chair of CPHA's board, she worked to strengthen the public health system capacity to promote health equity and social justice. Benita was a great advocate for public health and health equity, who will be greatly missed by her family and her friends, her colleagues and her students, and everyone at CPHA. We've produced a short video that will hopefully give those of you who didn't know Benita very well a glimpse into her character and her dedication.
Benita was my big sister, 9 years older. She was like a second mother and not only helped bring me up, but exposed me to so much of the world. Right from an early age, Benita believed in social justice and acted on it. For example, she was very active campaigning and working against apartheid and joining protests and petitioning government. She was also actively involved in the anti-discrimination activities of the time in our country and around the world. And she always had a deep passion to help right the wrongs of colonialism. In Benita's life and her work, she was known to be gentle and kind, with a strong sense and commitment to what was right and what was wrong, and making sure she turned things around in the world. She was known for her diplomatic skills, and she probably could have achieved peace in the Middle East if she was able to. Dedication and loyalty were two qualities of hers, the people she cared about and worked with, and the causes she was committed to. Her CPHA work brought her great pride and delight. She viewed the CPHA members as her confreres and was thrilled to have the honor to be president. On behalf of our family, thank you for honoring Benita. She would be thrilled that the people she cared so much for are here returning the love. Thank you.
When I think of Benita, I mostly just think of her smile. And her smile makes me smile. Benita's smile was gentle as her demeanor was, but also there was a spark of strength and challenging status quo that was essentially Benita, that she was a gentle, kind, quiet listener, but with a strength and a resolve to make change and to make a difference. And somehow I feel like that all comes together in her smile. So when I think of Benita, I think of her smile and her kindness and her respect and her dignity for everyone, but also with a spark of ambition to make a difference.
I would like, her to be remembered based on not only her work to advance population health, but just the respect and the calmness and honesty and the intention that she brought to the public health and nursing conversations. And she was really a nursing leader who I think changed the trajectory of nursing through over decades of advancing concepts of population health and health equity and social justice and all of these concepts which mean different things to different people. And like I said, it hasn't always been an easy road, but she definitely is a role model that will continue to hopefully move forward these concepts and this work across Canada.
She just was always there. It was steady. I mean, she was at CPHA, the conference, always. You would find Benita. You'd find her at the Community Health Nurses of Canada conference. So she, you'd find her at Manitoba Public Health Association. You'd find her at, when we started the Association of Registered Nurses, ground up here, Benita showed up. So Benita, in her very quiet, kind of unassuming way, was there and steady. So that kind of gracious, graceful, quiet, yet really strong presence in so many places that that are important to be. Even community meetings, that when I was within the Winnipeg Regional Health Authority, there would be Benita from the college, from the Faculty of Nursing in those community meetings. So she had that amazing sense, and my memory would be that she was so present and she just showed up in such a good way everywhere. And so I still feel her presence today.
I remember her love of the ukulele and the joy that she would get from making music. And we shared that joy of the sort of personal space for making music, and that sometimes you'll sit there and be making music and then you work out a problem that you didn't even know that the other part of your brain was working on. And as I think once I even bought her a ukulele stand to hang that on her wall where she does her work, so she can kind of she's stuck on something, just step away into that musical space. And it makes me smile because the ukulele is soft and uplifting. It plays well with others, and in so many ways is sort of the musical embodiment of the instrumental embodiment of Benita. And by contrast, my primary instrument is the accordion, which is kind of loud and squeaky and unapologetically out of tune, and maybe doesn't naturally play with others, has to work a little harder for that. So we used to joke about our instruments being our sort of personality embodiments, and we joked about making a weird album someday, which we never did, but it would have been something.
I think of Benita as a fierce advocate for social justice, as her intentionality and being quietly strategic. So for me, health equity is about closing health gaps. It is about being intentional, about understanding where health gaps occur, and remediating them, doing something different to improve the outcomes. And I think that that's part of the conversation with Benita, has been so much of that intentionality of what she brings forward, what she had brought forward, around thinking through, who was at the table, who wasn't, why, how could we change that? How could we be more strategic? How could we insert and bring someone into the table? What are their ways of thinking about things, and how could we engage them to think a little bit differently? And those relationships that were required to change big systems.
All of us who knew Benita are so saddened by her passing, a loss so unexpected and untimely. And yet, her passing has brought us together to celebrate her contribution to public health, and in particular, her dedication to population health in her advocacy role for health equity and social justice. The sadness of her passing has made us even more grateful for her public health contributions to teaching, research, and community service. In her public health and nursing career, she advocated for the marginalized and disadvantaged in society through her many publications, research, and policy work. The rich legacy of advocacy that she leaves behind will forever be entrenched in the work lives of the many nurses she taught, both in the undergraduate and graduate programs at the University of Manitoba. Dr. Benita Cohen, you are truly missed on so many levels, and as evidenced by the memories shared today, most assuredly not forgotten. Thank you.
I love that about her, that she was such an important member of the board, and giving of herself, but not expecting anything back, and just a real strong contributor, and a very easy person to like and want to know more. So I'm very sorry that she's left us way too early, because she still had so much to give and teach us.
Wow. Thank you to all of Benita's colleagues, friends, and family who shared their personal and their professional reflections about Benita. Just hearing them speak really makes her presence felt here at the meeting. And I want to acknowledge that Benita's brother, Ted, is here with us. Thank you, Ted, for being here, and we'll hear from him a little bit later. So now I would like to move on to the awards section of the meeting. I will ask Sume Ndembe-Ayo, our chair of the CPHA Award Committee, to please present this year's honorary awards. Sume.
Thank you, Vamini. It's a privilege today to be recognizing the outstanding recipients of CPHA's Honorary Awards for 2022. While I'll mention some of our recipients' characteristics, everyone receiving an award today is highly accomplished. So I'll encourage all of you on the line today to please read their full citations as they appear on CPHA's website. I'd like to begin with the Certificate of Merit, and the Certificate of Merit provides CPHA with an opportunity, excuse me, with an opportunity this year to give official recognition to an individual who has been especially noteworthy in these services to public health. This year's recipient is Regan Morey. Regan is an epidemiologist and public health officer with the Public Health Agency of Canada, and has worked with the Office of the Chief Coroner of Ontario since 2017. In response to the growing opioid overdose epidemic, Regan coordinated a comprehensive, high-quality electronic opioid mortality reporting system for Ontario, which is currently the largest in the world. This system has informed the development of similar systems across the country. Reagan worked with stakeholders to mobilize information on opioid-related deaths to support prevention and response activities. Since the establishment of this system, every project, policy, publication, or program which has been developed in the province of Ontario that includes opioid-related mortality data has certainly benefited from her work. Reagan is the recipient of this year's Certificate of Merit, which recognizes her fundamental role in data-driven responses to the opioid epidemic. Congratulations, Reagan.
Thank you very much. I really appreciate this this honor from CPHA for this award, and especially thank you also to the individuals that coordinated my nomination. But I really want to just first start with acknowledging the over 10,000 individuals that have died due to fentanyl, opioids, and other substances in Ontario since I started supporting the Office of the Chief Coroner in late 2017 in this role. And I want to acknowledge the loss experienced by their families, friends, and communities. And the desire to learn from their tragic losses really continue to drive my work. And I want to thank FAC for creating and supporting this unique opportunity to strengthen the relationships between public health and the death investigation system, and adding to the capacity in provinces and territories to respond to the impacts of this really unforgiving, unregulated drug supply. And I want to just add another couple thank yous, but to thank Dr. Heyer, the Chief Coroner for Ontario, and my former colleague, Dr. Emily Groot, for their leadership, mentorship, and really commitment to championing this work within the death investigation system to grow greater access and collaboration around the use of death investigation data to inform prevention activities. And lastly, I'd just like to thank my family for their support as I navigated this deeply meaningful and also very challenging work. So thank you again for this honor.
Thank you. And once again, congratulations, Reagan. Our next award is the Ron Draper Health Promotion Award. This year, the Ron Draper Health Promotion Award is presented to an individual who has made a significant contribution to health promotion by working in the community to build healthy public policy, create environments that support health, enable community action, enhance personal skills, and reorient health services. This recipient is Pegeen Walsh. Congratulations. Pegeen has promoted the health of Canadians of all ages and population groups over her 43-year career in leadership roles in provincial and federal governments, as well as in the not-for-profit sector in health promotion and public health. Some of the examples of her contribution include facilitating the creation and launch of Canada's first national AIDS strategy, overseeing the renewal of health promotion standards within the Ontario Public Health Standards, designing and launching Ontario's first diabetes prevention strategy, and contributing to the creation of Canada's International Youth Year program. By sharing her passion and her knowledge for health promotion through a bridging program for international medical graduates, she's facilitated the transition into new careers. Throughout her career, Pegeen has been guided by the elements and values of the Ottawa Charter for Health Promotion. Congratulations, Pegeen.
Well, thank you. I too want to thank the Canadian Public Health Association for recognizing my contributions through this prestigious award. And I'm very humbled and honored to be included with so many talented past recipients. And I want to thank those who nominated me. As a young public servant working at Health Canada, my colleagues talked a lot about Ron Draper and his innovative leadership, and I was very disappointed that I didn't get to work with him. Fortunately, though, by bringing together the international community around health promotion and that creation of the Ottawa Charter, he's left us with that blueprint for change. I'm proud I've been able to contribute to so many national, provincial, and local initiatives that built upon those strategies of the Ottawa Charter. And I was blessed too with many individuals who mentored me, supported me, guided me, inspired me, gave me advice, including my friends and family. Some of the lessons that were shared were keep focused on the goal and don't let others deter you. Think about what you can do versus what you can't do. Explore the possibilities, think big. Listen, ask lots of questions, be open, be curious, be patient. Welcome new ideas, welcome new ways of thinking, and keep the circle open. and find ways to get to yes. Whether it was in government or the nonprofit sector, I was also privileged to work with many talented teams and community leaders who also supported, advised, and inspired me. And they also helped keep me on the straight path when I veered off course. A few months ago, I came across Ron Draper's speech to the 1997 annual conference of the Canadian Public Health Association. And I was in awe of how the trends they identified 25 years ago that were threatening health, especially health equity, are still relevant today, as was his call for a 5-point political strategy to advance health promotion. He called on us to use our political voice to work together to counter the troubling trends of consumerism and corporatism to strengthen Canadians' sense of fairness and goodwill. So while the pandemic has had so many negative repercussions on individuals and communities, it also provides us with a unique window of opportunity. I look forward as a recent retiree and a member of CPHA and a volunteer with OPHA to work with others so that we can explore how we can use this window to affect change, to strengthen health promotion, public health, and build healthier communities. Again, thank you for this terrific honor.
Congratulations, Pegeen, and certainly congratulations on your recent retirement. I'm sure we will continue to see you in health promotion and public health spaces. Our next award is the National Public Health Hero Award. This award was created to broaden awareness and understanding of public health by recognizing members of the Canadian public for their significant contributions and exceptional commitments to promoting and protecting the health of Canadians. This year, the award recognizes a grassroots organization that has been at the forefront of advocacy for changes to population-level drug policies while providing community-based peer support to those who have lost a family member or those who are supporting a loved one currently struggling with substance use. This year's recipient to the National Public Health Hero Award is Moms Stop the Harm. With over 3,500 members across Canada, members of Moms Stop the Harm advocate locally, nationally, and internationally for implementing evidence-based public health and human rights responses to drug use and drug poisoning deaths. They have worked tirelessly to bring about changes to the policies and laws that have discriminated against and caused harm to people who use drugs. The advocacy includes support for public health and harm reduction initiatives, evidence-based treatment, decriminalizing the personal possession of drugs, and the provision of a safe and regulated supply of substances for people who use drugs. Moms Stop the Harm exemplifies community-based health promotion, inclusion, and advocacy for public change that is the heart of equity-driven public health. Here to receive the award on behalf of Moms Stop the Harm is Petra Schultz, one of the founding members.
Thank you so much for this. I have to say that we have been called many things, often online, but this is a particular honor. I never aspired to become a drug policy expert, a harm reduction advocate, or a champion for public health. All this changed in 2014 when our youngest child, Danny, died from accidental preventable fentanyl poisoning at age 25. Danny was in recovery when he bought one more pill that, unbeknownst to him, was fentanyl. There was nobody with him at the time that could have responded, and it was before naloxone, the antidote to an opioid overdose, was available. After Danny died, our family had difficult decisions to make, including speaking about his cause of death. When my husband wrote our son's eulogy, he asked our middle child about the meaning of the word. As a classics major, he knew. Loosely translated, eulogy means to speak well of someone. It was clear to us that if you speak well of someone, you do not tell lies. Being open about his cause of death resulted in a flood of friends, co-workers, and neighbors coming forward with personal stories or stories of loved ones struggling. Within weeks of Danny's death, I started to reach out to media and shared his story, as any action from the health system to the emerging crisis was absent. It is through these media stories that I connected with Leslie McBain and Lorna Thomas, who had also lost sons to substance use related causes. Together, we formed Mom Stop the Harm. There were 3 of us in the beginning, and now, as mentioned before, over 3,500 members across Canada. Most of our members have lost their loved ones, but increasingly we have members join who have a loved one who is using or has used substances. Our mission is to end substance use related stigma, harms, and death. Decriminalization and the provision of a regulated supply are our key aims. In addition to our advocacy work, we provide Healing Heart and Holding Hope peer support groups for families. We have virtual and in-person groups across the country. Early in our advocacy efforts, we focus on the Good Samaritan law, making naloxone available, and supporting the opening of consumption sites. As substances on the streets are becoming increasingly more toxic, we now focus on the provision of safe supply and decriminalization and prompting action from all levels of government. In 2014, there was no national surveillance system for drug poisoning deaths in Canada. National data collection, which, as I learned, Reagan contributed to, started in 2016. Since then, over 27,000 Canadians have died of preventable death. Every day, approximately 25 Canadians lose their lives to preventable drug poisoning. Never had I imagined it would get this bad. There are days when it feels like we're walking in darkness, but then suddenly someone shines a bright light that brings us hope for the future. This award is such a light. It shows our work is noticed, and we hope that such recognition will help us achieve much needed policy change. On behalf of Mom Stop the Harm, I want to thank the Canadian Public Health Association for this award. I also want to thank my fellow advocates and allies, especially people who use drugs, and everyone who supports our work. A special thank you goes to Heather Morris for spearheading this nomination, to those who wrote these lovely letters of support, and for you who bestowed this recognition to a group of mothers and others. Thank you so much.
Thank you, Petra, and congratulations to everyone at Mom Stop the Harm. So our last award today, certainly not the least, is the Artie DeFries Award, which is CPH's highest award. This award is presented to a CPHA member for outstanding contributions in the broad field of public health, with a preference given to Canadian contributions and to individuals who have substantially supported the objectives of CPHA. This year, it is bittersweet that we posthumously recognize Dr. Benita Cohen. We had the pleasure of watching an incredible video from Benita's colleagues and friends, and we're honored today to have Benita's brother, Ted Cohen, to accept this award.
Thank you very much for providing me the opportunity to accept the Artie DeFries Award on behalf of my sister, Dr. Benita Cohen. My name is Ted Cohen, and I am Benita's brother. The Artie DeFries Award is the CPHA's highest honor, marking the pinnacle of the recipient's career, named after a true leader in the field who devoted a lifetime to the interest of public health in Canada, and particularly to the CPHA. Reviewing the names of past awards recipients is humbling. These distinguished names include leaders who are internationally, nationally, and locally recognized for outstanding accomplishments and dedication to public health. Each recipient has made unique contributions which collectively have helped Canada to remain a leader in the field of public health. Benita would be honored to be included on the list of the Artie DeFries Award recipients. This award honors her legacy and her work. Benita's work in public health was fundamental to who she was. She viewed herself as an educator, a colleague, a researcher, and an advocate. Benita was an associate professor at the College of Nursing at the University of Manitoba. She was committed to develop the next generation of leaders in her field. Her devotion to her students was legendary, mentoring, coaching, and helping her students to grow and develop. She was also a valued colleague to members of her faculty, always there to confer, provide advice, collaborate, advocate, or listen. Benita's academic career included being an investigator in over 20 funded studies. Her research program was primarily focused on strengthening capacity to reduce inequities in health using a social justice lens. This included the areas of public health system capacity and strengthening capacity of health professional education programs to promote social justice and health equity. Equity was central to who Benita was. Her vision was to challenge us to improve the social, political, and economic conditions that perpetuate avoidable inequities. From a very young age, Benita worked alongside those who were disadvantaged to help create a more just world. Benita always coupled her intellectual mastery and understanding of subject matter with a rare, quiet diplomacy that brought people together and helped heal deep wounds to create lasting outcomes. Her work has influenced policy and practice locally, nationally, and internationally, resulting in changes that impact many people throughout the world. The CPHA had a special place in Benita's heart. Benita viewed the CPHA and its members as her colleagues, friends, and peers. She was so proud to be president and help lead the organization she considered to be her professional home. On a personal note, my partner Aaron and I were always glad when Benita visited Ottawa, our hometown, for her work with CPHA. It was a time for us to reconnect, eat some wonderful food, have a drink together, and discuss the topics in public health. I wish that Benita were here to accept this wonderful award personally. It is a tremendous tribute to her work and all that she believed in. On behalf of Benita, my family, her friends, and all that considered Benita to be a special person in their lives, thank you.
Thank you, Ted, and our condolences again to you and your family on the loss of your much-loved sister. Benita was certainly a cherished friend and colleague. I'd like to thank you and congratulations again to all our award recipients, and I'll turn the proceedings back to Vamini.
Thank you, Sumay, and congratulations to all our award recipients. At this time, you as members have the opportunity to ask questions about the business of the association. You can either type your question using the Q&A feature or click on raise your hand and your line will be unmuted. We'll just give people a few more, a little bit more time. If you had any questions, to either raise your hand or put it into the Q&A, please. Okay, here's a question from Lynn McIntyre. It seems as if CPHA has successfully received PHAC and other government funding to keep it in positive balance. How is the diversity of funding aim going? Thank you, Lynn, for your question. As you're alluding, it is always best to have a diversity of funding so that we remain sustainable now and well into the future. Currently, our funding comes from a number of streams. One is the conferences. So we have our own CPHA conference, which contributes revenue, as does our management of the CIC, the Canadian Immunization Conference. We also get funding, as Lynn mentioned, through PHAC, for public health projects that CPHA manages. And then we have some funding through our membership sales. And those streams have been fairly steady over the past several years and continue forward. In terms of new sources of funding, I would say that we haven't had too many other news sources. I don't know, Ian or Monica, if you would like to add to that.
Certainly, Bamini, I will just briefly note that the overall balancing of our revenue streams has improved dramatically in the past decade. So we are no longer overly reliant on those contribution agreements that we have with the federal government. So those projects, CPHA submits proposals through a competitive process, and a portion of our core expenses are covered by those projects. So we rely much less on those than we used to. We still have strong corporate supporters, which certainly help, and that support ebbs and flows over from year to year. But fundamentally, we are still missing a new revenue stream that would really push CPHA over, kind of solidify our revenue in the future. We will be launching a charitable giving campaign. We were ready to launch it, and this thing called COVID-19 came along, and so we have delayed that launch. It will probably next year when we launch that, with the hope that we will be able to build up a legacy fund, an investment fund that can support CPHA's ongoing operations in the future.
Thank you, Ian. I hope that answers your question, Lynn, and thanks for the question. Are there any other questions or comments from our members? Okay, hearing none. In closing, I'd like to offer thanks to you, our members, for your ongoing support. CPHA will continue to advocate for healthy public policy on current and emerging public health issues, while acknowledging and speaking out on deep-rooted inequities and social injustices. With courage, innovation, and commitment, CPHA will draw on the collective strength of its members' public health expertise and passion for change to accelerate progress in key areas. We look forward to seeing you at our next annual general meeting on Wednesday, April 26, 2023, when we hope that we will all meet in person at the CPHA's annual conference in Ottawa. If there are no further questions or discussions, I'll call this meeting to a close at 1:02 p.m. Eastern Time. Thank you, everyone, and have a good day.